Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. Welcome to today's video. We are going to cover the pros and cons of Medicare Advantage. If you're new to our channel and just visiting for the first time, please be sure to subscribe, hit the little bell so you get future notifications of when we release videos. We are doing it about twice a month on different Medicare topics. Feel free to leave a comment, give us a thumbs up, and tell your family and friends. Now, on to today's video. What are the pros and cons of Medicare Advantage? And I think we really need to start by what is Medicare Advantage. Medicare Advantage is Medicare Part C. It is a Medicare program. We have A and B, which is your little card that you get through Social Security, and there's C and D. So they are alphabetized. Medicare Part C, if you go to the Medicare guide, the way they describe it is it's an all-in-one program. So it usually includes a drug coverage, and it covers everything that original Medicare, which is A and B, is supposed to cover. And it says that you can get extra benefits. The one thing it doesn't mention is that, even though Medicare Advantage would be your primary, not original Medicare, you must be enrolled in original Medicare A and B in order to enroll in a Medicare Advantage plan. So you can't waive your Part B and you can't waive that premium. So the other thing about Medicare Advantage, they've been around since I've been in the business, and that's 32 plus years. And so they are traditionally a managed care plan. Back in the day, they used to be HMO only. That's all you had. So they were a subsidized program. They weren't sold by agents. In our area, in the Chicagoland area, depending on your zip code, they were there were two carriers, United Healthcare and Humana, and you called a toll-free number, and typically they were for very low income people. Now they've come a long way, and especially in the last couple of years, there's more and more options for people, and the baby boomers help that. I think the insurance companies are going after the baby boom market, and in the last couple of years we've seen a huge increase in the availability of products, not just HMOs, but PPOs. People want freedom to choose. They want to be able to choose their doctors, and these networks are a lot bigger. There is a third option called a fee-for-service plan. We don't recommend it because while it talks about giving you freedom, when you go to the doctor and you present your card, they can either say, yes, we accept it, no, we don't. There's not a list of doctors per se. So it is a little dangerous because you could end up not being covered by your physician. So we stick to the HMO, PPO traditional options. And let's just dive right into this, start talking about the pros. There are a lot of pros to a Medicare Advantage plan. One of them is very low premium. It costs you little or no. Some plans are $0, some are $38, $50. I've seen them as high as $140, which is a lot of money for a Medicare Advantage, but typically they're going to be less than $100, a lot of times less than $50. Many of the HMOs are zero premium, but there's actually now some PPOs that are zero premium, so that's huge. Another advantage is that, another pro is that it includes a drug card. There are plans out there that don't. They're called Medicare Advantage as opposed to MAPD. Medicare Advantage with prescription drug coverage. That's the majority of them, at least in the Chicagoland area. I've not seen a standalone MA too often. Most of the people that buy that are veterans because they have coverage through the VA. But most of the plans out there, you'll want drug coverage, and you can't enroll in Part D drug coverage if you're in a Medicare Advantage plan. So make sure you get a Medicare Advantage plans with the drug coverage. Most of them have them. The other thing is extra benefits. Another pro is they include extra benefits. They can include dental, vision, hearing. And dental and vision, it's interesting because they may be as good as a standalone dental plan, or they might be a little skinnier, or in some cases there are some carriers that are actually charging you extra to add that benefit to the Medicare Advantage plan. Now, hearing is one of those things that is not covered by Medicare. Medicare doesn't cover it. It's also not covered by the Medicare supplement plans. So really the only way to get hearing coverage that I'm aware of is through a Medicare Advantage program. So that is definitely a pro. Another pro is that or an added benefit is the silver sneakers or some type of healthcare discount membership program. United Healthcare has their own. It's called Renew Active. It's kind of silver sneakers on steroids, but they give you discounts to health club memberships, online classes, gym classes, yoga classes. I know with Renew Active, they have brain teasers. You can do brain activities on the computer, all designed for your fitness, both of body and mind. And another advantage of the Medicare Advantage is that the first year that you're enrolled, the government allows you, if you change your mind and you get buyer's remorse, you can get out of jail for free. You can go back to original Medicare within the first 12 months of any enrollment. So that is kind of nice. And last but not least, if you are dual eligible, meaning you're eligible for Medicare and Medicaid. So Medicaid is the program for people below a certain income level. They need help. And there's different levels of Medicaid. There's full eligibility and partial eligibility. Anybody that is Medicaid eligible really needs to buy a Medicare Advantage plan because of the low premium. The other thing is look for a dual eligible product. There are products out there. There are some look-alike dual eligible, and what they do is they actually subsidize a lot of the co-payments and out-of-pocket. So not only do you have a very low premium, usually zero, but you have very little out-of-pocket to go to the providers. And so that's huge. So that's probably the list of pros. Let's talk about the cons, because there are some people that have concerns with Medicare Advantage. And honestly, I've talked to some people who said, oh, they're terrible, and they were referring to years ago. And yes, years ago, there were very limited choices. The plans were not as good. The last couple years, they've really come out with some great plans. So one of the cons is that you do have co-payments whenever you go to the doctor. But this is something we're familiar with because if we're on a group health insurance plan through our employer, you typically have co-pays. But there's also co-pays not only for the doctor's office, but if you have a test done, there's a copay. If you have a surgery done, there's a copay. If you're hospitalized, there's a copay. So there's all these copays, and the copays for hospitalization can be anywhere from $225 a day that you're hospitalized. They do cap it all the way up to over $300 a day. So there is a maximum out-of-pocket, and the maximum out-of-pocket on these plans runs from anywhere from $4,000 up to $8,000. Now the government does limit what the max out-of-pocket is, and if you are considering one of these plans, please, please, please check out to make sure you are enrolling in a plan that has one of the lower max out-of-pockets, because that's a downside. If you have a large claim and you have to hit it, you need to make sure you have the money for that. The other thing is I guess a con would be the restriction of networks. So clearly if you're in an HMO is a health maintenance organization, you have to pick a primary doctor and you have to do everything through that doctor. You have to get a referral to a specialist. You have to get a referral to see a surgeon. You have to get everything approved, okay? If you go out of network, guess what? Zero benefits. Now they do have exceptions if you're traveling and you have an emergency situation, or you could just be not traveling, but just in your area and end up having an emergency and going to a hospital out of network. The emergency situation is going to be covered. Now with a PPO, that's a preferred provider organization. They're contracting with doctors and hospitals and negotiated a lower payment so that if you're in network, you're going to have better benefits. Of course, you have the freedom to go out of network, but the benefits go way down. There is a maximum out-of-pocket for benefits that are out of network, but you definitely want to be in network. So in network, you want to take a look at the hospital list, the doctor's list. And obviously, if your doctor's not in the network, that's going to be a major con because you're not going to be able to see your doctor. So you need to take a look at that. The other thing is another con is that you are limited when you can leave one of these plans. Now I mentioned in the first 12 months that you enroll, you can leave at any time. After that, you have to wait till either the annual open enrollment to change back to original Medicare as of January 1st, or there is a special enrollment period for people that are in Medicare Advantage plans only. It's only for them. It's January, February, and March. They can disenroll. You can switch plans. If you sign up for a plan, for example, and you find out later that not all your doctors are in it, your doctors are in a different one, you can change plans, or you can leave and go back to original Medicare. Now, the other con is that when you leave and go back to original Medicare, you may or may not have the opportunity to buy a supplement, no questions asked. What does that mean? They could ask you medical questions. If they find that your health is not good, they could decline you. So you do have to be careful about that. That is definitely an issue or a problem. If you had previously been on a Medicare supplement plan and then switched to a Medicare Advantage and you go back to a Medicare supplement, they'll allow you to go back to that carrier that you were with, no questions asked. But some people are turning 65 and enroll in Medicare Advantage and they never were in a supplement. So state of Illinois does have a carrier, it's Blue Cross, that is guaranteed to issue at any age. So there is an option for people in this state. But that is a con for sure. And the one thing that I will say is, you have to weigh the situation for your own personal needs. And when you're looking at this, you need to decide, is this good for me? And so I just want to spend a minute talking about who is this good for? Who would buy a Medicare Advantage plan and who would steer clear? Well, first of all, if you are on a budget, in any way, shape, or form, if your budget is less than $100 a month. Most Medicare supplement plans cost over $100 a month, and remember, you have to buy that drug coverage. If you are less than $100 a month, you definitely want to take a look at Medicare Advantage. And like I said, they've come a long way. There's PPOs, there's some big networks. There's a carrier in Illinois that includes all of the teaching hospitals in Chicago and has access to a nationwide network. So that's a good thing. Clearly, if you're on Medicaid, which is you definitely want to look at a Medicare Advantage, and specifically a dual eligible Medicare Advantage, or what they call a dual eligible lookalike, where they're going to, all those co-payments, they're going to subsidize that. And not only do you have zero premium, but you have zero out of pocket. So those people will want to take a look at a Medicare Advantage. Next, you're going to want to check and make sure your doctors are in network. If your doctors are in network, this could be a good option for you. I've done these searches. Our office has done these searches. We ask for a list for those people, and we will check. We have a website that we can do this. We will be putting it on our website, actually, so that you can check on your own, and we will be making that available soon. But basically, we have a tool where you can plug in all your doctors and it will tell you what networks they're in, what Medicare Advantage PPO plans. You can shop by PPO, HMO, and all the providers in Illinois. So we can help you with that. Clearly, if your doctors are not in the network, now you have a decision to make. Do you, one, change doctors, or do you go out of network, or do you not consider a Medicare Advantage plan? So that is very important when you're buying one, is to check the networks, check the doctors. Another person that would be good for a Medicare Advantage plan is if your doctor says, we only take Medicare Advantage. And I have been doing this a very long time. For the first time ever in the fall of 2020, our phones were blowing up during Medicare open enrollment because there was about 36 doctors in a DuPage Medical Group, which is a very big group in the suburbs, right? Growing. It's a doctors group. And there was about 36 doctors that said, we are no longer taking original Medicare. And if you want to continue to see us, you must enroll in a Medicare Advantage. We are only taking Medicare Advantage. I had never heard this in my life. And so now when people turn 65 and I hear DuPage Medical, I say, hey, check with your doctor. We had somebody this summer who was retiring, and it turns out her doctor was one of those 36 that said, we're not taking original Medicare. She was looking at a supplement, but she couldn't see her doctor any longer. And so the decision becomes, for those people that got that letter from those doctors, is do I switch so that I can continue seeing my doctor, or do I switch doctors? And you have that choice. So that is something to take a look at. If your doctor only takes Medicare Advantage, this would be a good product for you. And of course, if you want all the extras, the benefits, the perks, the vision, the dental, the hearing, the health club memberships, that's going to be a good option. And if you're okay with paying some co-payments, you're used to this normally, there's a trade-off, low premium, but co-payments and possibly higher out-of-pocket. With a Medicare supplement, you have very little out-of-pocket, but a higher premium and an increasing premium. So if you're okay with it, I think it's fine if you don't have a lot of doctor's appointments, and you probably won't hit that out-of-pocket max or even come close, even if you had one hospitalization. I did have a woman going through chemo and surgery, and she hit about half of her max out of pocket. She had about $4,000 and she hit about $2,000. So it's possible, that you won't hit that max out of pocket. So let's talk about who is it not good for. Who are these plans? Steer clear from. Well, one, your doctor's not in the network, duh, right? So if you can't see your doctor and you do not want to switch, not a good plan. You certainly can go out of network, but take a look at the max out of pocket. Some of them skyrocket, and it might not be worth the hassle. Also, if you take a lot of not just medications, but if you have a lot of illnesses, if you have a lot of issues going on, where you are seeing this doctor and this specialist, and you have all these conditions you need to manage, you may very well hit that max out of pocket, right? And so I use my dad as an example. He's deceased now, but when he was alive, he had a lot going on. He had dementia, he had this, he had that. And while he was in increasing premium with the supplement, he could see all of his specialists, he could see all the doctors at all the hospitals, anybody that took Medicare. He had the freedom and the flexibility to go where he wanted, and they didn't have to write checks all the time. Because I guarantee you, whatever premiums he would save by being in a Medicare Advantage, he's going to pay in the max out of pocket. So if you have a lot of medical claims going on, it might not be a good option for you. And last but not least, if you like to travel and you want the freedom to go to any doctor in the country. When I say travel, some of the PPOs on the Medicare Advantage sides do have nationwide networks, but they don't give you access to it. Depends on the carrier, so you have to be careful. You have to get pre-certified, let them know. And we have a lot of people in Illinois that have second homes, or they go down to Florida and they're there for 3 months at a time or 6 months at a time. So make sure you take a look at that if you are traveling a lot, or if you just want to say, I want to be able to go to Mayo Clinic, I want to be able to go to Cleveland Clinic, I don't want to have restrictions. Oh, by the way, Mayo Clinic takes original Medicare. So if you have original Medicare and a supplement, guess what? They don't take, I think they might be in one Medicare Advantage plan, but it's not the best in my opinion. So, if you want the freedom to see any doctor in the country, then you do not want a Medicare Advantage plan. So hopefully this video enlightened you, told you the pros and the cons. First of all, we told you what a Medicare Advantage was. Second of all, we told you the pros and cons. And last but not least, we said who is it good for and who's it not good for. So if you need any help, if you're looking for assistance, please feel free to contact us and check out our website, cbhealthins.com. Soon to be coming, we are going to have the tool where you can look up all your doctors online and you don't need our help, but of course we're here to help you. So thank you for watching. This is Kathy Bukowski, the owner of CB Health Insurance. Stay tuned for future videos. Give us a thumbs up and please feel free to share with your family and friends. Thank you.